Yep, we can hear you and we can see you. You can go ahead and start your comments.
Okay. Afternoon. My name is Tracy McClain. I'm a registered nurse with more than a decade of experience at the Austin State Hospital and as a Travis County jail nurse. I've also worked with Corrections Corporation of America and as a legal nurse for the OAG tort litigation in Austin. I know exactly what competent care looks like, and I know what happens when people don't have timely access to appropriate care. My son, Ra, is a poster child for how the system of care failed and repeatedly criminalized people with serious mental illness. Ra was a thriving student at Morehouse College until a violent crime caused traumatic brain injury and later schizophrenia. He was brilliant, a chess player, a deep thinker, a young man who graduated magna cum laude, even while managing the early stages of his illness. But after his first psychotic break, our family entered a system that does not treat people like Ra. It abandons them, it cycles them, it discards them. In the last 5 years, Ra has been arrested 7 times, detained dozens of times, and pushed through 6 so-called long-term stays that last only 3 weeks. Today, he sits in the Williamson County Jail on criminal trespass charge, a charge rooted entirely in untreated illness. He has been deemed incompetent to stand trial more than once, yet he repeatedly times out of jail while waiting for a state hospital bed. And every single time, court-ordered medications is withheld until just before his release, guaranteeing that he will decompensate and he will return to jail. This is not a system failure. This is a system design, a manufactured revolving door. As this committee is well aware, a symptom of schizophrenia is lack of insight. Rob cannot sign a release of information. He cannot advocate for himself, and yet the system blocks me, his mother, a registered nurse, from advocating for him. I'm here today to demand 3 things from the committee since y'all are about the access of care. Okay, first thing is we need a robust continuity of care protocol. When a person is deemed incompetent, families must be allowed to participate in the plan of care. We hold the medical history, we know the medication responses, and we know the triggers. Blocking families, which jails often do, does not protect anyone. It guarantees harm. There is much emphasis in this committee on jail-based competency restoration, but no mechanism to involve a primary caregiver. Second, connection to appropriate level of care upon release from jail. Ra is about to be released from jail in about a week or 2. He needs high level of care with frequent follow-up by a case manager. After his last hospitalization, he was enrolled in Assertive Treatment Program Act, but no one came around to check on him. When I went to Blue Line to ask to re-enroll him, they had no idea what I was talking about. Lastly, Texas needs intermediate care facilities for people with serious mental illnesses. People like Ra, who cannot engage in voluntary treatment, do not belong in jail and cannot wait months for a bed at the state hospital. Rider 56, which passed last session, was created for this exact situation. I need Ra to be enrolled in this pilot as soon as possible. Ra's not a criminal. He's a patient. Texas can't continue to use jails as warehouses for people with severe mental illnesses. This committee needs to focus on better access to care in the community in order to prevent our loved ones from becoming a forensic population. Thank you for your time and consideration of my words. Thank you.
Thank you, Ms. McClain.